Hi everybody, and welcome to the webinar on the MACI-II. Just some brief housekeeping before we make a start. So the webinar is going to last around half an hour, 45 minutes, depending on how many questions and things come in. I'm going to be focusing on the MACI. But if you have questions relating to this or other Milan related questions, you can ask questions in the questions box, which should be visible to you, or if not, there'll be a way of you getting that up on your screen. Just a bit of background to this tool. It's going to be new. It's going to be released quite soon. It's not yet available on Pearson's website, but there is a link that you can sign up to for updates on when it will be available. So I don't have an exact date for you yet. But the purpose of this webinar really is just to give a bit of an overview of the tool and an update. By way of an introduction, my name's Ruth. I'm a forensic psychologist, and me and my team, the majority of our work is focused on assessment rather than treatment, although we do a little bit of treatment, and we work with lots of adults, but we also work with adolescents. That's largely in the criminal justice system, but also in the family court systems and people who've really come to the attention of services needing psychological assessment. So we do lots and lots of assessments, and so we need lots and lots of different tools available to us to be able to do these assessments and make sure that we can use the most up-to-date tools. We're using the best tools to answer the questions that we've got about a person. So I'm going to introduce the MACI to you because it might help answer some of those questions that you've got about those that you work with, so that you can make treatment decisions or adapt treatment appropriately and see what's at the core of people's problems as a guide to help your formulation, and any needs for further assessment can be identified as well. So I've been using things developed by Milan for a number of years. So the adult MCMI, which recently in the last 2 or 3 years developed into the MCMI-IV, and now the MACI-I's been updated to become the MACI-II. Those of you not so familiar with Milan's theories, I'm not going to cover them in depth today, and he's well published on the topic. I don't think I could cover that if I had a day to speak to you, but there's some good wider reading that you can do around Milan's theories that will really help you understand not just how this tool links to what we understand from the typical medical model that some of you might be moving away from anyway in terms of DSM, but also how it relates to how Milan posits his theories around personality and personality development, and how people see and experience the world around them. So I would encourage you to do a bit of wider reading, as well as finding out a bit more about the MACI today. So today we're going to cover what the MACI-II is, changes since the MACI-I. We're going to cover scoring and reporting considerations. I'm going to cover a little bit about telepractice, meaning assessment that's not in person, that might be via video, or other means, particularly in the current pandemic, that's becoming more relevant. And also we'll think about questions and answers as well. So please ask questions as we go along throughout the webinar, because if you've got a question, no doubt other people will have a similar question, and it really helps the flow of the webinar and that you get the right things answered in terms of what you need to know for your practice, because that's one of the aims for today. But there'll also be time for some questions at the end. So if you type questions in the box, I should see those come up and be able to answer them accordingly. Or if they want that Pearson needs to answer, the Pearson guys are also online with me today, and they might be able to help you with those as well. Okay. So what is the MACI-II? So the purpose really is that it's used to identify and clarify the clinical concerns of adolescents specifically, adolescents who might exhibit emotional, behavioural, interpersonal symptoms, people who are referred for psychological evaluation, or those who are undergoing therapy for any reason. Importantly, about this tool, it's not adapted from an adult tool. A lot of young person measures are adapted from the research and from existing tools that relate to adults, but the MACI-II isn't. It was developed based on the literature on adolescent functioning specifically. So it's very much a tailored tool rather than one that's more of an afterthought for young people, because we know that the presentation of young people, the trajectory of some of those difficulties can be quite different. And it's really a great time to intervene, isn't it? When you get people presenting with these problems, we can provide a treatment plan or therapy that's well informed through good assessment, so that we can help minimise those problems reoccurring in the future and becoming more entrenched personality traits. And those of you who work with adults, I'm quite sure you'll have worked with somebody as an adult with really strong personality difficulties, and lots of experiences that you can formulate contributed to that, but only if only they'd got some good intervention early on and at the right time, those things may not have developed to the highly problematic level that we were seeing with the adults. It's 160 items. It's a true or false in inventory in terms of the answers are true, false, which I find quite useful in some ways. It's not a Likert scale. It's not pick on a scale of 1 to 10, for example. But what you do find with true-false inventories are that young people and adults quite often will say, oh, well, sometimes that's true, sometimes that's not true. So it's really important to follow the instructions of the test, which generally are to think about what's true or false, is it true or false for them most of the time, and to go with what their gut feeling is really. So there are some prompts in terms of what you might say to support people in making a decision and their answer. So whilst true or false seems easier and is easier to understand than the Likert scale, some people find it quite difficult to commit to an answer. So with your encouragement, they might pick the answer that's most relevant to them. Basically, it assesses personality characteristics in young people. The age range is 13 to 18. It's said to take around 20 to 25 minutes to administer, but that will entirely depend on the young person concerned, how many questions they might have. But at least it gives you a guide to consider whether they might have rushed things if they've answered it in the side of 10 minutes. Or if they're taking a long time and might be struggling to understand the nature of the items. This will be really important for you to keep an eye on. So that's just a guide which is changeable. It's DSM-5 anchored or aligned, meaning that you will recognise similarities from some of the personality disorders that are diagnosable, but it's not designed to provide a diagnosis as a standalone tool. It's designed to inform your judgment. And of course, we're not going to be wanting to label people so young with any sort of disorder. We want to look at their personality patterns so that we can help and intervene. But positively, with it being DSM-5 anchored or aligned, you're going to have some familiarity with the tool and with what you're reading and finding in the results as well. Those of you who aren't so familiar with Millon's theories, just as a basic outline, Millon first described his theories way back in the 60s, and these theories are founded on 3 polarities. So they're the polarities that you can see on the slides of pleasure-pain, active-passive,
I found this on the web,
and self-other. My Apple Watch seems to want to join in, so do excuse that. But from this perspective of these 3 polarities, personality patterns are looked at as learned strategies to secure positive reinforcement and to minimise punishment. So, for example, the pleasure-pain polarity represents the nature of responses we elicit from other people. So that might be positive, attention, praise, safety, or it might be negative, like frustration or disapproval. The active-passive polarity looks at behaviour that we use to either maximise reward or minimise pain. So active personalities might take the initiative and interact with the environment to improve it, to achieve positive well-being and success. Whereas passive personalities, they're much more reserved and they might be more maintaining of an accommodating stance to whatever the environment offers them. So it's about active improvement or adapting to environment. And then the self and other polarity looks at how people really try and enhance their life and gain satisfaction to avoid pain and discomfort. So if we think about personality being on a spectrum and personality patterns being on a spectrum, Millon's theory puts forward that with his 3 polarities, people are at various areas on these 3 polarities, and therefore the combination of their personality structure is very unique. And that's why tools like the the MACI and the adult Millon tools really help hone in on the combination of features associated with someone's personality style, rather than looking to achieve one or more than one diagnostic label. And it's also about how those things interact as well. In terms of the population then, I've already mentioned that this is for adolescents aged 13 to 18. And that's who the normative sample was based on. So there was a sample of about 1,100 adults which formed the base rates. And these young people were all of those people referred to assessment for mental health problems, assessment for behaviour problems, or assessment or referral for psychological therapy. So there is a range of age within that, backgrounds, diversity, gender, education level and setting and so on, but it's designed to encompass, to use with people who are in a similar position in that they have been referred for psychological assessment or treatment and therefore would be considered in a clinical group, which I'll talk about again shortly. The age is considered, so it's really important that when you use the assessment, you put the date of birth or age in correctly, because there are two age bands that are considered when the results are being calculated. So, for example, the cluster of age information is that the 13 and 50-year-olds were in a cluster and the 16 to 18-year-olds were in a cluster. So make sure that you put the age in correctly. There is a Spanish version. The reading level has been simplified somewhat to be more inclusive, and I understand fourth grade to be age 9 or 10 from Google. Maybe someone will correct me if that's not right, but it is designed to accommodate people whose reading age might be at a lower age than their chronological age would indicate. So perhaps those who might not be familiar with complex language, for example. It's also available on Q Global, which is something I'll talk about a little bit later as well. Q Global is Pearson's online scoring and reporting system, which allows you to administer tests remotely, as well as score up some tests that aren't administered remotely and analyse results and so on. Just a word on a clinical versus non-clinical population. A clinical population is what this tool is designed for. It's not designed for people who haven't shown behavioural, thinking or emotional difficulties. There are different tools that can help with that and assess non-difficult, I suppose, personality problems or personality strengths. So this is a tool that looks at a clinical population only, but it's important that we know what a clinical population is, because generally you're all here because you work with people who may have been referred to your service or to you individually because of behavioural concerns, vulnerability, trauma, attitude concerns, emotional difficulties and so on. Anybody referred for assessment on that basis would be counted in the clinical population, whether that's through, for example, mental health services, whether that's through their family being assessed in terms of family services, or family court, for instance, and there are behavioural difficulties or emotion problems for that person. It's a really common misconception that I see sometimes in how, in particular, adult MCMIs are reported, where people say, well, I've used the MCMI for this assessment of this person who's been referred to me, but they're not in a clinical population because they're not a patient or they don't have a primary diagnosis. But those who are referred to psychologists or therapists and mental health services for assessment are within that clinical group and are appropriate to be using this tool with. So generally, for a lot of you, I would imagine most of you on here today, it would be relevant to the population that you're working with. So that would be here adolescents who've been referred for further assessment for valid reasons, usually associated with behaviour, attitudes or emotional problems. This is an outline of the tool structure. So there are 3 validity scales. There are 24 clinical scales that look at personality patterns. There are scales that look at subjective concerns, expressed concerns, and there are clinical symptom scales as well. So very much like its adult counterpart, the MCMI, it looks at different areas of somebody's personality and how that is expressed in their mental health. So it splits, typically you will have seen the split of Axis 1 and Axis 2. It does split it down into personality and clinical syndromes and express concerns as well. The validity scales are useful because depending on why that person's been referred to for assessment, there might be reasons why they might not answer openly. Because of the context of assessment, it might be some other reason, it might be feeling very vulnerable and not really wanting to open up to you. But it provides an objective way of looking at whether that person may have responded defensively, for example, and you can then take that into account in your interpretation of the person's profile. So for each of the personality patterns, again, very much bringing this in line with the MCMI-IV, which some of you will be familiar with, there are 3 corresponding Grossman-Facet scales. So the Grossman-Facet scales are subscales within each personality pattern, which help us to interpret the elevation on that scale appropriately. So generally with something like the MACI, we would look at the highest scoring personality patterns and we would then look at the Grossman-Facet scales to see which areas within that pattern are elevated. And that might be, for instance, really useful in looking at aspects of functioning that's problematic, and there might be a strength in another area that's non-problematic, even if that scale is raised. So it helps you provide a really personal formulation and a really personal and individualised treatment plan. The generated profile report or the interpretive report on Q Global generally generates the Grossman-Facet scales for the highest scoring scales for you to interpret. And as I've mentioned earlier, or certainly will do shortly, if not, the hand scoring that you can do with it, you can work these out from the hand scoring procedure as well. So that's the tool and what it is. Some of you will have used the tool, the older version of the tool before quite a lot, or maybe you've just heard of it and not used it yourself. But I thought it was important to include what's new with the MACI-II. So there are updated norms now. As you'll be aware, it's so important to update norms and make sure that the tools we're using are representative of the populations that we see in our day-to-day work. So it was really important to update the norms. There are some new items. Some of them have increased clarity, so they're a lot clearer, the wording is different, and the review of the items really was also to make sure that the item content was relevant to young people, especially because those developing these tools are not young people. So it's really important that we don't make assumptions in the test development about what young people might or may not relate to. So we need to think very carefully about the group that we're assessing. There's improved report content on Q Global, for example, using more accessible language. So lowered reading age, as I've mentioned before, to be more inclusive. And like the MCMI, there are noteworthy response categories, and there was already in the MACI-I, but there are increased categories here. And the noteworthy responses really are intended, they're questions that if answered, if endorsed, they're intended to alert clinicians to item level information that's worthy of special attention, that might deserve either interpretative consideration or, importantly, immediate clinical intervention. So, for example, one of the questions is, my anger is on the verge of exploding. I'm going to hurt as many people as I can. Clearly, there might be an imminent risk there that's important to deal with. And another one, you can imagine, important ones are around suicidal ideation. So there's one that's more and more often, I thought of ending my life. So clearly things that we need to provide more immediate support for rather than, waiting for therapy because there might be imminent risks. So there are now 12 report categories. There are also gender neutral reports available on Q Global, which you can select if you're generating the report from Q Global, which by no means is necessary. There is a profile report option as well as the interpretative report available. What else is new then? We've got the 2 validity scales that I mentioned. So we've got an inconsistency scale that really assesses random responses, for instance, and a response negativity scale, which looks at people who respond negatively. The borderline scale now has its own items rather than being overlapping with others. And there are 3 new clinical syndromes. We've got disruptive mood dysregulation, post-traumatic stress, and reality distortions. Importantly, you'll notice there that things like reality distortions, they don't come with them a label like some sort of delusional disorder, for example. They look more at what's happening for that person, so we can interpret that from a person-centered point of view and look at what's happened to that person to contribute to how they're thinking, feeling and behaving. So brief notes and administration then. As mentioned, you can do pen and paper. Typically, a lot of my work involves pen and paper because I work a lot in justice settings, so it's really important to me that that's available. But depending on your setting, you might choose to do this via Q Global. With Q Global, you can do this with the examiner present, so you can sit with the person and be administered. That way you're on hand for technical difficulties, you're on hand to answer questions and clarify language, for example, if there's any questions arising. And you can also do it remotely via Q Global, like you can with a range of other assessments, which will provide the participant with a link to complete the test, and it will alert you when that's been completed. A lot of you will be doing remote assessments at the moment because of the pandemic, so I thought to include a little bit more information about remote administration. But what I will say is that there is some useful information available on Pearson's website about specific tests like this one, but also in general about remote administration and the support with, using screen share where required to administer an assessment in terms of the copyright, etc. There's some guidance from Pearson online about that. But with the MACI specifically, the MACI-II, you're advised to either have somebody present with that young person, so a facilitator, somebody who can be on hand for technical difficulties to help them understand language, and also because the content might be distressing, it does ask about trauma, it asks about behaviours of concern, and actually the person might need support with that. And also it's advised that if you can't do that, you watch the completion via live video so that you can offer that support as mentioned, but also importantly to know that they've completed it themselves, to know that they've spent adequate time doing that rather than rushing their responses, and that you can see if there were particular areas that they might struggle with. I don't know about you, but I often find that there's a lot of good qualitative information that can be gained from observations during administration. So, for example, somebody might struggle more to answer questions around childhood and so on, and or trauma and abuse, and they might answer that there's been no problems in that area, but you may have noticed something and your observations may be such that actually that's worthy of further exploration when that person is ready to explore that further. Importantly, if you're administering remotely or if you deviate in any way generally from manual and standard administration, note in a report that you've done it differently, note the method of administration and any problems or observations that you've made with that as well. There is also some useful British Psychological Society guidance on remote assessment, because remote assessments, full stop, regardless of which tests you're using for your assessment, haven't really been the subject of serious evaluation on efficacy and the impact. My own opinion is that practically it's a lot more tiring and a lot more draining to register, to be able to register what's going on in front of you through the video, to look at your notes that are in front of you without that person being there, making sure that they know that you're paying attention to them, even if you might look down from the camera, for instance. I find it very tiring, and I think that those who I assess also find that very tiring. There are things that you can't observe, body language as effectively. Eye contact, is looking at a camera akin to eye contact. I'm not sure if there's research that would support that it is or isn't. So these are all things to think about. So look at Pearson's guidance, but please also look at your professional body's guidance. And I know that the British Psychological Society have, have specialist guidance on these things, and that as things change with the pandemic, guidance will change as well. So try and keep up to date with that to make sure that you're doing what you can and doing the best for remote administration, to make sure that you're balancing the need for assessment, which is important, which can be really acute. People need acute help in times of distress, balancing that with needing to do the assessment remotely, whether that's appropriate, whether that person has learning difficulties that are such that just cannot be supported, and so on. So make some notes about how you've administered it, and anything else that you observe. Scoring and reporting. Again, just a brief word on this really, that hand scoring is available, but on Q Global you can get profile reports which will produce a graph, or an interpretive report which will produce a graph and qualitatively interpreted information. I think that, like most of you who are on the webinar today, probably it'll be part of a wider assessment. So usually you'd be using that interpretive report, if you use that, to inform your own assessment and making sure that everything that you're putting in your assessment report is relevant and appropriate for that person concerned, because you have more information than a scoring system does about how what's found within the MACI relates to that individual, and does that hold up in real life, or is that elevation, for example, a bit of a red herring or a false elevation because of their response pattern or the context or current distress, for instance. But what's really positive is that the new reports have more appropriate and simple language. Older versions, so when it was MCMI-III, which is now MCMI-IV, some of the language was really complex, really uncommon words, quite Americanized, but with the MCMI-IV and the MACI-II, there's an improvement there. So it can really inform what you're writing up and inform your formulation. It's really important, though, within that, you take responsibility for that interpretation and don't just use what's generated blindly. Equally, when you're scoring things up using an online system, professionally, I think it's really important that you still understand the basis on which you're scoring, that you understand that the tool uses base rates rather than standardized T-scores or Z-scores, and why, and that you also understand any technical adjustments that are made. For example, within the MCMI-IV, there are adjustments made if someone's highly anxious or depressed, because it can overinflate scores on other scales, and that isn't necessarily discussed in depth in a generated report or profile. That's something that the assessor needs to be aware of generally to be competent in using psychometric tests appropriately. So I think that people using generated reports, I always use the profile graph at the very least for my Milan assessment, but importantly I'm very manual and very much generated and the technical adjustments that are made to that, because we are responsible for making sure that we don't just rely blindly on technology to score things, and have a good baseline understanding of psychometric testing as well. Linking in with that, the reports have an increased therapeutic focus, as does the tool. So it's not just a focus on where that person is now, it's also a focus on how you can get them where they might want to be in terms of improved well-being, improved mental health, and behaviour, for instance, and helps us understand risks that might be associated with that behaviour to themselves or other people, and their general formulation. It's relevant in the current climate to think also about culture, about race, and tool development. So tools generally, it's important that you look at the sample on which they were normed and developed, and consider the background of the person that you're assessing. And if they don't fit neatly within the background of that population, the normative sample, it doesn't necessarily mean that you can't use this tool, but what it would mean is that you as the clinician have a responsibility to interpret the findings in the context of that individual, accepting that some of their cultural background, some of their life experiences may not have been well represented in the samples that the tools were developed on. Positively for tools like this, quite often we'll see validation of the use of the tool and research emerging with different cultures and different populations. But it's really important that as clinicians, we address any conscious or unconscious bias when we're reporting on people based on their background, and also that we make sure technically that we're aware of the issues around that and normative samples as well as clinically. So I think recent world events have reminded us of those things in particular, and how it may well be that psychometric testing alone might bias against the person that we're assessing. So we need to be very aware of that, and just make sure that you're looking to the tools and your own judgment when using them. So use the tools, but use them wisely. And then a final point, really on a similar note, is that a crucial point for any personality pattern assessment, particularly in young people, is about taking care ethically in how you report things. So it's really important not to label people inappropriately. There is stigma associated with even just the words we might use about somebody. Borderline, emotionally unstable, that can stay with someone for a long time, even though what we're saying about young people is that by identifying these traits now, we can work to reduce them so they don't become entrenched and adult problems as well. So language is really important. It's important to refer, for example, to personality patterns or characteristics and not disorder, because we don't want to mislabel and label those that we work with, and also to help keep them engaged with the process and look to therapeutic change and ask what happened to that person, where has all this come from, rather than what the label is that's associated with them. So that's a bit of an overview of the MACI-II. There were some technical questions that came in about user requirements. So Pearson will have that information on their website as well. And I know that my colleagues who are online from Pearson here have answered some of those questions as they've come up about user requirements and professional registration. So the website for Pearson will detail that for you. Q Global is a separate system to your Pearson account in terms of you use an account to order psychometrics, but Q Global is different and you need to set up an account if you don't have one. And again, there's some useful guidance on Pearson's website and they can help you with that and any technical queries that you might have as well. You can send questions in to myself or Pearson about the MACI, which we will do our best to answer. Importantly, this webinar is being recorded so it can be distributed. And if we've got some questions in or some of those that came up that Pearson were able to answer as we went along, we'll be able to attach those as a list to the webinar when we send that out. In terms of ordering the MACI-II, like I said, it's not yet available on Pearson's website, but there is a link for you to sign up so that you receive updates on it. And people often ask generally, should I be using new psychometrics immediately? What if I don't use them immediately? Generally, psychometrics are developed because of updating norms, updating tools to reflect current practice and so on, all the things that I've identified so far in this webinar. So it is considered best practice to use the most up-to-date tools unless there's a very good reason not to. But people aren't expected to, the day something is released, start using the new tool. There might be some time to phase that out and in. And on the Q&A page, which I looked at on Pearson's website earlier, there are some Q&As about that there too. So have a look at the web page because your Q&As might be answered on there as well. But thank you ever so much for tuning in today. Just a brief overview of the MACI-II for you, a little bit about what's new, a little bit about what's developing, and then hopefully a little bit of food for thought around considering not stigmatising the young people that we work with or any person that we work with, and considering race and identity as part of your interpretation of any test, but especially personality measures like the MACI-II. So thank you very much for tuning in. We will close the webinar at our end in a few seconds, and good luck with the use of the MACI-II. So thank you very much.